Well, welcome back to What's Now, continuing to focus on our health, specifically lung cancer. I had an in-depth conversation recently all about updates, new research, treatments, and more. Let's take a look.
Not long ago, small cell lung cancer was considered the forgotten cancer, and treatment was generally chemotherapy and radiation. But now, for the first time in years, treatment of small cell lung cancer is entering a new frontier where advancements in therapies are giving patients much hope. Today, we have Montessa here, a never smoker who was 28 years old when she was diagnosed with small cell lung cancer in 2006. Montessa is joined by Dr. Dwight Owen, a thoracic oncologist at the Ohio State University, here to share stories of hope and share how medical advances in small cell lung cancer treatment are saving lives. Dr. Owen and Montessa, thank you so much for being here today.
Thanks so much for having us.
Dr. Owen, you just returned from the World Lung Conference. What is new and exciting in small cell cancer research?
This is a really exciting time for patients with small cell lung cancer. In just the last few years, we've had more treatments approved for these patients than we have in the last few decades. And these treatments are really changing the lives of patients diagnosed with this disease. These treatments typically work different than chemotherapy. They work with the immune system and work better than chemotherapy. And we're also learning that there are actually really different subtypes of small cell lung cancer. That it's not one size fits all, that within small cell lung cancer, there are different classifications and subtypes, which may lead to different targeted treatments for each of those different subtypes and really allow us to deliver personalized care for small cell, which is not something that we've been able to do until this point.
And Dr. Owen, we hear a lot about non-small cell lung cancer. How is small cell lung cancer different?
That's a really important question. So small cell lung cancer is the less common but more aggressive type of lung cancer compared to non-small cell lung cancer. The names come from how the cells look under the microscope, but they are two very distinct and separate diseases. Small cell lung cancer has historically had a number of barriers that have made it challenging to treat. Screening is uncommon, it grows very rapidly and can spread very quickly to other organs, which means that by the time it's diagnosed, it's often, unfortunately, at an advanced stage, which in and of itself makes it more challenging to treat. But this cancer also can come back very quickly after we do treat it and is more resistant to treatment at that point. So all of those things combined have made small cell lung cancer really difficult to treat and challenging and contributes to why it's considered sort of the forgotten cancer.
Montessa, you are a small cell lung cancer patient. Tell us your story.
Yes, at the age of 28 in 2006, after being misdiagnosed twice, the first time I was diagnosed with inflammation around the rib cage. The second time they said I had bronchitis and also thought something might be wrong with my heart and did an EKG. But I still had a persistent cough and I had chest pain that wouldn't go away, as well as back pain. And that would lead me to a visit for my cousin to drive me to the ER. And they would finally do an X-ray where it revealed that I had a tumor the size of a cantaloupe in my chest, a 15 centimeter mass tumor in my chest that had to be biopsied, and that biopsy revealed that I had small cell lung cancer.
Oh, what a story. And you were only 28. How did that feel?
Yes, it was a total shock. I had no idea what was wrong with me. I really was not a sick person. And to not be able to breathe, I guess now in times of COVID that is relevant, but to not be able to breathe and to have your life one day going to work and being a 28-year-old, a special education teacher, I was healthy, what I considered healthy eating, and to be diagnosed with cancer wasn't anywhere near my radar of thinking.
No, it must have been just a devastating diagnosis. And Dr. Owen, how is small cell lung cancer currently treated?
Yeah, so the treatment for small cell lung cancer for years and decades was what Montessa went through. So chemotherapy with potentially radiation to the chest and to the brain. It really wasn't until the last few years that that's changed. And the big change has been the introduction of these immune therapies, which I mentioned earlier. And these immune therapies allow our own immune system to see cancer cells that are camouflaged from the immune system, that are using a technique to evade the immune system. And these immune therapies can train our own immune cells to target and destroy cancer cells. And when that happens, when our immune system is fully engaged in the destruction of cancer cells, the responses are much longer and better than they are to chemotherapy, allowing our patients to live better, live longer, and offering really more hope for patients with this disease.
And Montessa, tell me about that treatment. What was that like?
So, like Dr. Owen said, when I was diagnosed in 2006, the standard treatment was the same as it had been decades before. So I had chemotherapy. The chemotherapy is what they call a platinum-based chemotherapy. So it wasn't always pleasant. Fatigue was the worst symptom from that. And then I had chest radiation simultaneously. So someone would take me to the hospital for radiation, and then someone would take me to the next hospital for chemotherapy. And I had brain radiation. At that time, that was when they said, let's give you brain radiation to prevent the cancer from going to your brain. And it showed me that I was stronger than I thought I was. And I'm glad that now people have options. There were no options, being plural, when I was diagnosed. And this is the promising research that's coming out.
And when you were diagnosed, Montessa, were you surprised at how little research had been done in the past?
I was shocked. I found my doctor said I had small cell lung cancer, and he didn't give me any doom or gloom, but I went on Google Doctor when I got home because I said that is, really weird name. It's a very simple name, and learned more about it. And I was outraged and angered because even though lung cancer kills more people, more individuals than breast, prostate, and colon cancer combined, yet it is one of the least funded. And I was wondering, why am I being treated the same way they were 30 years ago? When I saw breast cancer patients, the needle had changed. So I knew something had to be done, and I wanted to lend my voice to this disease.
Dr. Owen, who should get screened?
Yeah, so that's a really important point. So we've only had lung cancer screening in this country for about the last decade. Before then, there was no screening test that was approved to detect this cancer. A study was done and published in 2010 that showed that lung cancer screening with a CT scan can detect the cancer earlier and can lead to better, more effective treatments and more likely outcomes for cures, and overall can save lives. So our current recommendation is that patients 50 years or older who currently smoke or who recently quit smoking should talk to their doctor about getting a CT. It's a screening test. There's no prep. It's non-invasive, and it could potentially be life-saving. But it's also important to remember, as Montessa's case shows, that if you have lungs, you can get lung cancer. So this is not a cancer that only occurs in smokers. About a quarter of patients in the United States with lung cancer are never or non-smokers, and about 50% in some other countries in the world of patients with lung cancer are never smokers. So there clearly is a misconception that this only occurs in patients who smoke.
And Montessa, what would you like our viewers to know about your journey and everything that happened with you with small cell lung cancer?
I want people to know that there is hope on the horizon. I'm here and hopefully fulfilling my purpose of helping someone else who's going to be diagnosed with this disease. And this is what I've been waiting for since I started my advocacy work, to hear Dr. Owen talk about these changes in research and having options so that it won't be a one-size-fits-all. I'm an educator. We don't do a one-size classroom. So it's the same for our care in medicine, that everybody is unique and that their cancer is unique. And hopefully this will be what changes the face for the next patient diagnosed with small cell lung cancer.
And Dr. Owen, anything else you'd like us to know, and where can we get more information?
Yeah, so the thing that I would like to highlight is that the treatments we have today are only available because of clinical trials. In clinical trials, we say we're testing tomorrow's treatment today. Clinical trials, it may be the best treatment option for a patient depending on their situation. And I think there's some misconceptions about clinical trials. There's concern about whether they're safe. There's so much regulatory and safety work that goes into making sure that the patient's safety is the top priority, or that the patient might be assigned to a placebo or non-treatment or sugar pill. And for extensive stage and advanced small cell lung cancer, in early phase trials, all patients will receive the treatments that we're testing or the standard of care, or maybe a combination of both, to figure out if we can move the needle, like Montessa said, advance the treatments and make sure that the next patient that's diagnosed has a better treatment option than we have today. If your audience is interested in learning more or how they can help, I'd direct them to our website, lcfamerica.org, or text LCFA at 41444.
Well, thank you so much, Montessa. I really appreciate your willingness to share your journey with small cell lung cancer with our audience, and Dr. Owen for your time today. Really important life-saving information. Really appreciate it.
Thanks so much for having us.